Hi everyone, Shannon DeConda here with NamUs again, and today's Let's Chat is a broad spectrum overview on assisted surgery. If you follow NamUs, you know that every month for the year of 2024, we've had a focus, and this month's focus has been surgical services and creating some awareness and highlighting different facts. In that consistency, I thought that we would cover assisted surgery. And I started thinking, so what do we really need to cover? I mean, what's really tricky about auditing assisted surgery or the compliance factors around assisted surgery? The things that I think are tricky are more with the physician angle, right? A lot of times it's making sure they document an assist was in on the surgery and how they document it. A lot of times we see the assist is documented in the header, but then we don't see the documentation of what the assist did. And I think that's where we need to make sure that we're educating our providers on what's required. In the last Let's Chat, I covered template documentation of op reports. So, one of the things I would kind of pose at you is, could you have a template statement of what your assist does? And I think the answer there is maybe. And as long as that is willing to be updated as it needs to be changed per surgical encounter. But I think I would turn that question around on the surgeon. Does the assist perform the same duties in most every surgery? And if that answer is yes, then I think the answer for the template could be yes, provided it's updated when necessary. But we need to remind our physicians that assist documentation must be present in order to bill for an assist. One of the things I also like to make sure that I educate physicians on is assists are not often paid for their surgeries. And when they are paid, the reimbursement is not the best. So, a feasibility analysis, something we don't often do as auditors and compliance professionals, but sometimes creating that feasibility analysis to show them if your NP or PA stayed in the office and continued to see patients at that direct bill rate, 85%, if they average seeing 4 patients an hour, what that reimbursement would be versus scrubbing in, scrubbing out, being in the OR at 15%. A lot of times we can show them that the reimbursement isn't great and they would be better off having the nurse practitioner or PA in the office seeing patients. Now, I do want to say quality of life for our physicians as well as for ourselves. I mean, put yourself in their shoes is a lot. There's a lot to be said for that. And I've had a lot of physicians over the years tell me, yes, but if I can make my kid's soccer game, if I can get home for dinner, all of those things make a difference. And I'm willing to forego having those patients seen in the office or having that additional revenue in order to expedite my surgeries. And that makes perfect sense to me. I've been a traveling mother of 3 children for right at 20 years. So I completely understand that fact. So that doesn't escape me. But I do always want physicians to understand taking them to the OR could be the loss of revenue. Yes, you may be saying, Shannon, should we always be focused on revenue? We are for-profit entities. And since we are losing revenue, it should be our job to show profit and loss and where that money is going. We have a webinar coming up on just those types of topics of incident 2. We have a lot of physicians that are pushing back. So much revenue is being lost right now. Reimbursements are being cut. Shouldn't we go back to incident 2? I don't know. Should we? So we're going to have a webinar on that. But my point here is if we need to look at reimbursement, then we should have compliance, those that know the rules looking at that. So again, looking at those angles, knowing what's compliant, knowing the documentation, yes, we should look at those. So I hope this is just helpful reminders on assisted surgery, knowing that documentation, and maybe giving your provider some feedback on when to use assist, when not, when it could be a good thing and not a good thing for your practice. And with that, I think I'll sign off for today, and I hope you return next time. Leave me some comments down here. If you do that feasibility analysis for your providers and it has some good feedback, let me know. I'd like to hear from you. I hope you have a great day.